Hey guys, it's me again, Jim at A New Day 365. So I'm reading this book, Being Sober, by Haroutunian, MD, Physician Director, Professional and Residential Programs, Betty Ford Center. And I just read this one little, uh, I don't know, this one page that was kind of interesting. A matter of choice. We can define disease as a loss of function of an organ or organ system that produces a set of symptoms with a known or unknown cause. For example, diabetes has a target organ, the pancreas. We know the cause, which is a dysfunction in insulin production or in insulin's action at the cellular level. And the effect is that the body becomes glucose intolerant, which results in high blood sugar levels that over time damage organs with small blood vessels, including the eyes, the kidneys, and the heart. Diabetes is a chronic, lifelong, incurable disease that is absolutely treatable. A patient with diabetes follows dietary, exercise, and medication instructions to attempt to normalize blood sugar levels. But if left untreated, diabetes takes its toll on the bodies. Chronic elevated blood sugar levels cause the small blood vessels in the peripheral nerves, eyes, heart, and kidneys to thicken, eventually occluding proper blood flow. This can result in pain, numbness, and tingling in the lower extremities, destruction in the retina, early susceptibility to heart attack, and most especially renal failure. The awesome consequences of a disease run rampant. Are these consequences preventable? Often the answer is yes. If the diabetic follows a daily treatment regimen, she can live to be 100. Left untreated, diabetes is a fatal disease. That is, it must be treated one day at a time. You don't get credit today for the insulin you took last week. Multiple sclerosis is another example of a chronic, lifelong, fatal disease. Treatable but not curable. The target system for the MS is the brain and central nervous system. It is a chronic, organic disease of the brain with a relapsing and remitting pattern that may come and go with devastating symptoms. For many years, alcoholism and drug addiction were considered a weak person's inability to control desire. Most people believed that drinking was simply a matter of choice and that anyone with a drinking or drug problem was reckless, self absorbed, and irresponsible. Research dating back to the 1950s, however, has led most medical professionals, myself included, to understand that addiction is not a moral issue but a disease, a brain disease to be specific, and one that has genetic links. The National Institute on Alcoholic Abuse and Alcoholism, the NIAAA, the National Institute on Drug Abuse, the NIDA, and the Substance Abuse and Mental Health Services Administration, SAMHSA, continue to do important research on the complex genetic disorder known as addiction. We have proof addiction is a disease. So why do most people, including addicts and their family members, find this fact difficult to accept? Perhaps it's because addicts and alcoholics seeking their drug of choice have done some pretty bad things, transgressing the boundaries of society and the law. No doubt an addict's behaviors can be intolerable. Living with an addict can bring family members to the brink of insanity, but addiction is a brain disease with signs and symptoms manifested in part as behaviors. And like diabetes or MS, alcoholism and addiction have a target organ, a cause, and an effect, which we call symptoms.